Good morning, everyone. My name is Erin Javier. Today's presentation is about reducing falls. Our objective includes discussing statistics as well as identifying the risk factors associated with falls. At the end of this presentation, you will be able to list at least 4 nursing strategies that will help in reducing falls based on evidence-based practice. Lastly, participants will be able to demonstrate how to use bed fall monitor and also assess for the 4 P's, which are pain, potty, position, and possession. When it comes to statistics about fall in the United States alone, the most common cause of non-fatal injuries for people who are 65 and older are unintentional falls. Between 700,000 to 1 million people in the United States falls in the hospital each year. This fall may result to fractures, lacerations, and also internal bleeding. Did you know that falls with or without injury can occur in the hospital can affect not only the safety but also cost effectiveness? Fall-related injuries can increase resource utilization. Injuries from falls can lead to increased length of stay and also increase the chances of unplanned readmission. Because of this, an action to reduce the risk of harm resulting from fall is now part of the National Patient Safety Goal conducted by the Joint Commission. Yes, you have a question?
From that age group of 65 and older, who are more likely to fall, males or female?
Great question. According to the article written by Curry in 2008, females are more likely to fall. However, males are more likely to die from fall-related injuries compared to females in this age group. Now let's talk about risk factors. The following risk factors associated to falls are age, incontinence, use of medication such as pain medications and sleeping medications, history of fall, confusion, ambulation, like if they need walker or cane when they're ambulating. Another risk factor is medical condition. Medical condition like if they have low blood pressure, osteoporosis, or vitamin D deficiency. Now let's talk about nursing strategies that can be used to reduce falls based on evidence-based practice. One is collaboration of interdisciplinary team regarding fall prevention upon admission, use of fall risk assessment tools such as functional assessment tests, use of visual identification for those patients who are considered high risk for fall, like armband with the sign of fall risk.
My facility uses armbands like that, and we also have a sign called Walk Fly. It's a drawing of an eye, and we place it on the patient's door.
Great. Another strategy is also to use non-pharmacological remedies to help them sleep instead of giving them sleeping pills right away. It is also important to identify medication that has overlapping side effects. Another valuable nursing strategies is the use of fall prevention electronic toolkits such as bed fall monitor. Also, implementation of teach back method. This is when you educate your patient about fall prevention, give them resources to look back if they have questions and ask them questions on how to prevent falls, and also to call when they get out of the bed. This will help them reinforce teaching about fall prevention. Also, keep the environment clean and well lighted. Make sure that the handrails are fully secured and hide those wires so the patient won't trip over it. Last but not the least, you want to make sure that nursing staff needs to do intentional time rounding and assess for the 4 P's. Now let's discuss the PICOT question, which is right here. PICOT, for those who are not familiar, this is an acronym to help formulate clinical question and guide the search for evidence. P stands for patient or population. I is for intervention or issue of interest. C is for comparison of intervention. O is for outcome, and T is for the time frame. For this presentation, the PICART question that will be used is in elderly medical surgical patient is hourly rounding by nurses and patient care technicians compared to the use of bedfall monitors effective in reducing the number of falls over a 30-day hospital stay. According to the reviewed articles, which is right here, the best practices in effectively reducing the rates of fall among elderly medical surgical patients are the following: conducting hourly rounding by the staff, nursing staff, providing education, training to the staff, and discussing how to properly implement the 4 Ps. Having organizational support throughout different departments and different disciplines during admission and until discharge, and also acquiring visual identification, like we said earlier, the fall wristbands, to remind everyone who are high risk for falling. Use of fall prevention electronic equipments like bedfall monitor. This is a copy of a bedfall monitor, and today we will learn how to use the bedfall monitor, how to activate and deactivate it. You may have a different type of bed and bedfall monitor at your own facility, but for now we will use this one from the facility where I work at as an example. So this is the key, and this is the different choices for the bed exit sensitivity. So the higher the risk of your patient, then you will pick this one. This is for the moderate, and this is for light sensitivity, okay? We tend to use the middle one, so you have time to actually go to the room right away. So to activate it, you have to press the key button and whichever bed exit sensitivity that you need at the same time, and then it will turn on like this with the light, and then it will say on button. To deactivate, you will press the same button at the same time, just like when you're activating, and it will turn off, okay? So after this presentation, you will be asked to demonstrate how to activate and deactivate the bedfall monitor as part of your competency. Now we will assess for the 4 Ps. What are the 4 Ps?
Pain, position, body, possession.
Great. When performing hourly rounding, the first step is to introduce yourself. My name is Erin Javier, and I will be your nurse for tonight. I will take excellent care of you. The next step is to describe to the patient, and if they have any family members or friends at bedside, what hourly rounding is. Because we want you to receive excellent care, we will be doing hourly rounding from 7 p.m. to 10 p.m. and every 2 hours after that. During this time, we will check on your pain, your comfort, and if you need to go to the bathroom. We will also ask you if you need anything to be moved closer to you, or if you have any other concern you want to address. We will be using the whiteboard to write the nurse's name and the patient technician, and also the charge nurse and our extension. So if you need anything, you'll be able to call us. So now let's address the 4 Ps again. Pain. How is your pain? So you want to make sure you medicate your patient. Position. Are you comfortable? Turn your patient who are high risk for skin breakdown, or those that just needs a little bit help turning. Potty. Do you need to go to the bathroom? Possession. Do you need to move the phone or the call bell light close by? And also perform any scheduled tasks, such as scheduled medications prescribed by the doctor. Lastly, let your patient know when you will be back. For example, I will be back in about an hour, and do not forget to ask if there's anything you could do for them. And make sure you document that you did your rounding by signing your initial or a check mark on the whiteboard upon rounding. After this presentation, you will be asked to perform a return demonstration on how to assess for 4Ps as part of your hourly rounding competency test. Thank you so much for allowing me to do this presentation. Please make sure to fill out the evaluation quiz before leaving. Thank you.